Hey everybody! As we've seen from Module 1, the position of your baby can have a big impact on your labour. And back-to-back babies increase the chance of having a longer labour, which is more uncomfortable and potentially may increase the likelihood that you'll have an epidural and an assisted birth as well. In the next 3 videos of this module, I'm going to teach you the Align Your Baby 6. It's 6 everyday activities that you can incorporate, and they include the way you sit, the way you sleep, walking, bending, exercise and reboso. The idea really is that you want to make your baby uncomfortable in any position except that lovely frontal position, which makes birth a little bit easier. Before 30 weeks of pregnancy, your baby has got plenty of space to move and their position may change frequently. So please don't worry if that's the case, and during 20, 25, 26 weeks your baby is lying across or bum down. That's completely fine. As they grow bigger, there's less room for them really to change position, and so around 34 or 35 weeks of pregnancy, your baby is more likely to stay in the position that they are in at that point. Remember, the space that your baby is growing in is a shape, and that shape is influenced by the shape of your womb, the muscles and ligaments that support your womb, and also your pelvis. And so your baby will take a position that fits them well. The Align Your Baby 6 is a series of 6 simple lifestyle choices that you will do to gently encourage your baby into a better position or keep your baby in a good position that they are already in. If you're watching this in early pregnancy, I would start incorporating the Lifestyle 6 from around 20 weeks of pregnancy. And if you're 30 weeks pregnant, then it's time to really get stuck in and do it every day. I have to say that if your baby is lying back to back, you need to make a considerable effort to encourage him or her to turn. If you spend the majority of your time sitting back at a desk or slouching on the sofa, driving your car, then that is really going to encourage your baby into the back-to-back position. And 5 minutes here or there, or an hour of exercise once or twice a week is not really going to cut it against 5, 6 or 7 hours slumped in that back position at your desk. And that's why it's called the Align Your Baby lifestyle. It's for life, not just a symbolic gesture or nod. And whether you know if your baby is lying back to back, or maybe you don't know, it's good to be applying these principles every day. The Align Your Baby 6 should be followed throughout pregnancy until the day your baby is born. At 34 weeks, there's a bit more room for your baby than 36 or 38 weeks. So your baby is more likely to get into that better position. So don't leave it to the end of pregnancy when you've just got a week or 2 to encourage baby into that great position. Hey guys, we're here with the lovely Sam.
Hello.
Sam is our mum who's going to be helping us teach you the postures and positions as we go along through the next few videos. Tell us, Sam, how many weeks are you?
I am 30 weeks pregnant.
Yay! So if, like Sam, you're 30 weeks pregnant, it's really important that you get stuck into the Align Your Baby 6. And really I recommend that you start from 20 weeks and earlier if you're feeling well. So this one is going to be all about sitting, and it's really a video for everybody. So even if you've got a more complicated medical history or you haven't been particularly well, this is something you can still apply to your life. So in our modern lives, we love to sit in postures where we lean back, so the desk, the sofa, and the driving the car. And this means that gravity is working to pull your baby to the back. And when we lean forward in our forward leaning positions, gravity is working beautifully to pull the heaviest part of your baby, so your baby's head and your baby's back towards the front, which is what we want. So, where do we start? So we're going to start by demonstrating. Thank you, Sam. So, we're imagining that we're sat on a normal chair, maybe working at a desk. And on a normal chair, we're going to be leaning forward a little bit or to work, but probably as we get tired through the day, we'll start leaning backwards and we're slumping, creating a lovely hammock here for your baby to lie.
Baby likes it kicking.
Oh, really?
Yeah. Move back.
Amazing. Baby's like, hi. That's so nice. Oh, it's creating that hammock. So what we're going to be doing with our sitting postures is encouraging mums to lean forward so that that hammock is at the front and it's encouraging your baby to the front. So I'm going to demonstrate 3 ways that you can do this really easily. So the first one that we're going to do is going to involve our big birth ball. So I'm just going to grab the birth ball. So we've brought the birth ball in for Sam to sit on. So the beautiful thing about a birth ball is you can't lean back, because if you do, you're going to fall off. So you have to open up your pelvis a little bit and sit forward, and that's straight away making a bit more space for your baby at the front. The other thing that's brilliant about a birth ball is the way that your hips and your knees are. So Sam's quite tall and this birth ball is just a little bit small for her. So I'd recommend that you find a ball that fits your height. With a birth ball, we have the position where the hips are slightly above the knees, which is really good for opening up the pelvis. And Sam, would you do some lovely hip wiggles?
Circle.
So nice. How does that feel?
Very nice.
Brilliant.
Good.
So you're really mobilising all the joints and the muscles in your pelvis. That's okay. Beautiful hip circles on the ball. I'd recommend that you get a ball for work if you work at the desk, one for home if you can as well, and that you spend the last few weeks of your pregnancy as much as you can on that ball. So we're going to move on to our next one. I'm going to bring in a kitchen chair. So I must admit, Sam is a yoga teacher, so we're cheating a little bit because she's very well informed. So with this chair, we've got a kitchen chair and we've turned it back to front. So how does that feel?
I feel like I'm in a 90s boy band.
Ah, you look a little bit like you're in a 90s boy band. We need a cap back to front. We are in fact near E17, so exactly.
Perfect.
Yeah,
I always had a
amazing.
crush on Brian Harvey.
I hope you're watching, Brian, but probably you're not.
I'm sure he is.
The brilliant thing with turning the chair around is, again, you're leaning forward, your pelvis is open and you're supported. So in pregnancy, this is a great position actually to eat your dinner at the kitchen table or your breakfast, and it's a lovely one for labour. So for labour, if your lovely partner is going to give you a massage as one of the coping tools for labour, it gives brilliant access to the back. Mum's supported and can rest, and we could even maybe pop a pillow there so that if you're really tired you can just rest down a little bit. So I definitely recommend using this position a lot, and we're going to show you one more. So we've got Sam on our wooden bench here, so this is replicating what you might do at home on your sofa. Do you do this at home, Sam?
I may be guilty
Oh!
occasionally of the slouch.
The
yes.
slouch. I'm so guilty of the slouch at home on my sofa. So what we want to do is to avoid this slouchy position on our sofa and in our beds. So we're going to change it, because as you can see that hammock is there, so baby's going to go to the back. So can we get you to sit up a little more, Sam? We're going to use some cushions behind you to start off with. So how's that doing? Is that okay? So we've got 2 cushions behind Sam, and this straight away is pushing her forward. So I'd recommend on the sofa, ladies, no more slouching. So we're going to be leaning forward And then we can also pop one underneath as well. There you go. Let's do that. We're cushioned up to the max. Brilliant.
That's it. Yeah.
This is the posture we're looking for, really. So the hips above the knees again, tummy's forward, the space at the back is gone, and that's brilliant. So if you're working on a hard chair at your desk, this is a good one.
And a very good excuse to steal all the cushions.
You got all the cushions.
All the cushions.
Absolutely. So ladies, I want to talk to you about sleep. So this is our second of the Align Your Baby 6. And it's so important to rest, relax and recharge in pregnancy. It decreases stress, it decreases adrenaline, which we know really blocks the birthing hormones, oxytocin and endorphins. It reduces cortisol and has a really great positive effect on you and on your baby as well. So when you sleep or when you rest, take this as an opportunity to slow down mentally and connect with your baby. You can listen to a really lovely deep guided relaxation or yoga nidra, and this has a lot of benefits for you. I have one that's free and you can listen to that anytime on my other website, which is thehypnobirthingmidwife.co. Jump on there and you can listen to that lovely deep relaxation. It gives you the space that we so often lack to tune into your body and really turn down your mind, and that has such value for if you're busy and you're still working, or maybe you've got little ones that you're looking after and you don't get a lot of downtime. So very, very important. This is one to do when you're reclining on the sofa. So instead of lying back, you're going to be lying on your side, and it's definitely a lovely one for bed. And it's something that everyone can do. So whether you're an active, busy person or you've actually been put on bed rest by your doctor, this is important because we spend maybe 7, 8, maybe 5, 6 hours lying down every night. And so that is a long space of time when you can positively impact the position that your baby is lying in. So I'm going to show you now with lovely Sam how you can lie to help your baby into a better position. So I'm here with lovely Sam to show you one of the sleeping positions, which is really great. So first of all, Sam, are you comfortable?
Yes, very. Thank you.
Good, excellent. So this is a really great way to sleep. And before I tell you about it, it's also great for the sofa. So instead of lounging back on the sofa, as I do quite a lot, you can lie on your side on the sofa, and so you can still rest, and that's really important. So we've got Sam lying on her left side. So if you can lie on your left, that's great because that encourages the heaviest part of your baby, its head and back, towards the left side of your uterus where there's a bit more space. We have got Sam in quite a straight position, so her knees aren't up too close to her chest, and we've got a pillow between the knees to try and keep the hips and the pelvis nice and aligned and straight. And you might want to pop the pillow just under your bump as well, just to give it a little bit of support. Oh, Sam looks comfortable. And as I said before, don't worry if you wake up in another position. That's going to happen sometimes. It's just that you make that little conscious effort that when you're resting or sleeping, that you do so on your left with lots of lovely support. So ladies, we're talking about the third in the 6 Align Your Baby Lifestyle 6, and it is walking. Something so simple. Now, walking through your pregnancy and right up until the day that you give birth is super, super important. Obviously, if you have been put on bed rest by your doctor, this will not be appropriate. And if you have any medical issues or problems, please check in with your midwife or doctor to make sure that you can follow this walking advice. So, first of all, why walk? As you walk, you are really strengthening your lower back muscles and you're lengthening your psoas muscle. So your psoas muscles are kind of mega muscle which joins the bottom of your spine to your legs. It's kind of like wings that go all the way round, and I'm just going to demonstrate how it works. So when the psoas is flexible and relaxed, it's supple and balanced, it really helps your baby to descend beautifully into the pelvis and encourages baby into a better position. But when your psoas is short, it can become overly tight, and that can be a negative thing. So let me tell you or show you what I'm talking about. So if this is my psoas muscle, this lovely piece of ribbon, you can see that it's attached from the base of my spine to my thighs, and when I'm sat, it's quite short and tight. But when I stand up like so, it's lengthened. And that's actually a really good thing for your psoas to be longer and flexible and loose. It's really good for birth. So when you walk, what you want to be doing is leaning a little bit forward and not be tempted to lean back, which is what we often do when we're pregnant, because with that weight pulling forward, we overcompensate and tilt our pelvis forward. So if you find that you're really doing this a lot, it's quite a good idea to get a support belt, one of those pregnancy support belts, so that it supports you and you're less likely to lean back. So in terms of walking, how much should we be doing? So ideally you want to aim for five days a week, and you're walking at a really good pace, so quite swift, not too slow and casual, and you're walking for about 2 to 3 miles, which is the equivalent of 4 or 5 kilometers. Now that's quite a good length of walk. That might take you 30 or 40 minutes at a good pace. If you haven't done much exercise recently or for a while, that is going to be way too much for you. So you want to start off with 3 shorter walks per week, probably of about 15 or 20 minutes, and you might not be going so fast. You don't want to stretch anything or hurt yourself. You want to ease into it. And you can get this into your daily routine. So perhaps instead of thinking, oh, I've got to do my walk today, you could, instead of taking the car, instead of jumping on the bus, you know, walking to work, maybe make at the weekend, if you're off from work, a lovely walk is part of your relaxation, your self-care, and it's time for you. So you're really changing your mindset around that and thinking of that walk as a kind of investment in yourself and also in your birth, and it's really, really valuable. So that's it, ladies. One of the Align Your Baby 6 is just to walk, trying to walk regularly all the way up until the day baby's born, and that is going to stand you in really good stead. So ladies, we are going to learn our bend. So this is a really valuable bend that you can do as part of your Align Your Baby Lifestyle 6. I call this a 4-4 bend, and you'll see why as I go through and explain it. So I originally learned this position when I was a student midwife, and I learned it from an amazing home birth midwife that I trained with. She didn't give it a name actually, and just explained it as a bend, which essentially is what it is. And I saw her explain this to mums antenatally in their appointments many, many times, and I also was lucky enough to see her use this in labour at a couple of home births, and to see it work beautifully to encourage babies that were back to back to turn, which was an amazing thing to see as a student. You shouldn't do this posture if you are on bed rest, and if you do have any medical problems or issues like high blood pressure, please do check with your midwife or doctor before you go for it with this bend, because it can feel a little intense and the blood does flow down to your head and you feel a little bit of pressure. You ladies, do be responsible with your own health and take care of yourself. It's super important. So the reason that I call this the 4-4 bend is because we will be doing a bend, and I want you ladies to take 4 breaths when you're down in the bend before you come back up again, and I want you to try this 4 times when you do it. So I'd recommend that you do it with me now as I demonstrate with Sam, so that you really get an idea of how you do it and you feel comfortable and confident doing it in the future as well. This bend, I've also seen it known as the forward leaning inversion, so you maybe have seen it before as well, it might be familiar. So what does this do inside? So let me just explain to you a little bit more about why this is a good position to do. So when you're down in the bend, it makes room at the bottom of your uterus or your womb down here, and actually with gravity brings your baby up a little bit out of the pelvis, and it allows your baby to rotate to the front. And although the baby and the pelvis do stay the same size, it's by changing the position we change the relationship with the baby and the pelvis and all that space, which is a really helpful thing to do. For many transverse babies, this will work beautifully to give them a little bit more space and allow them to come and turn head down. And you can definitely do this in labour as well, as part of the set of postures that you do to encourage baby to turn from back to the front. It's also really valuable to do before you do your breech bend, which you'll see in module 4, if your baby is breech or transverse. So how many weeks should you be doing this from, and how often? So I'd recommend that you do it once a week from 20 weeks, and definitely from 30. And if you're 34, 36 or 38 weeks pregnant and you suspect that your baby is back to back or lying breech, then I would recommend that you do this 4 times in every 24 hours. So I'm now going to show you with Sam how to do your 4-4 bend. So we are going to demonstrate our 4-4 bend, which is a really important one of the Align Your Baby Lifestyle 6. So I wouldn't expect you to do this every day, but I think it is good to do it once a week from 20 weeks, and if you're like Sam, 30 weeks, definitely. And if you know that your baby's lying back to back, then this is something that you would definitely be doing every day 3 or 4 times until baby turns. So before we start, if you want to do this with me ladies, that's great. Do have someone with you there the first couple of times that you do it, because it can make you feel a little bit dizzy, you get the rush of blood to your head, you sometimes get a bit of a pounding in the head as well, so you need to do it slowly and thoughtfully as well. So what we're going to do is I'm going to get Sam to lean forward when she's ready, and I'm going to support her as she goes down. Well done, Sam. I'd like you to take 4 normal breaths when you're down, and when you've taken your 4th breath, you can come back up again. That's brilliant. You don't want to stay down there for more than 30 seconds because that will be too much for you and your baby. Beautiful. And when you're coming back up again, you're going straight upright. Perfect. That's brilliant. And if you're doing this at home, I'd recommend that you do it 4 times. So it's 4 breaths down there, and then you do it 4 times. And Sam, you're a yogi, aren't you?
Yes.
It's a little bit like doing a downward dog, would you say?
A little bit more intense feeling in the head.
Absolutely.
The blood rush is a little bit more intense than a downward dog.
So for you, how was that for you going down?
Good. I mean, I think at first you look at the bed and I think, oh, that actually looks quite far.
Yeah.
But it's not. Your arms are longer than you think they are. And no, it felt fine when I was down there, but I think the blood rush to the head is more than a downward dog would be.
I think that's true, absolutely. So please be mindful when you're doing it at home, ladies. Just take it easy, ladies. Do it slowly and have someone with you to support you when you do it the first few times. It does get easier the more times you do it. So the last in the Align Your Baby Lifestyle 6 are exercise and reboso. So for the exercise, staying active through your pregnancy will really support a quicker and easier birth. And the exercise that you choose to do will probably be related to what you enjoyed doing before pregnancy. It's so much easier to get yourself doing something that you love than dragging yourself to something that you feel that you should do. You can choose from things like yoga, Pilates, swimming, or maybe something you did before. If you're unsure if the exercise is really suitable, always check in with your midwife and doctor just to be sure. Exercise really changes the internal angles between the spine and the pelvis, and it offers your baby the opportunity to get into a better position. So I really recommend it. And if you don't do any exercise already, you can start by doing something gentle like yoga positions at home. In the next video, myself and Sarah, the yoga teacher, are going to demonstrate with Sam some really lovely gentle yoga positions in the Yoga 6. 6 simple yoga postures that you can do at home to help strengthen and align your muscles. And the last one in the Align Your Baby Lifestyle 6 is reboso. The reboso is going to get a video all to itself, so you can see that in the last video of this module. We'll see you there.